Specimens. It's often necessary for us to send a sample of urine or stool or blood, etc., to help identify how the body is functioning and to contribute to the assessment of a patient's health status. They help aid in the diagnosis and provide information about how the disease is progressing or how the patient is responding to treatment. It's necessary to provide education to our clients prior to a collection because they'll be more cooperative if they know what you're doing and why you're doing it. Be aware that some specimen collections can be embarrassing to the client. If you're uncertain about the proper procedure of how to collect a specimen, then make sure you check with the lab that you're affiliated with, and they will provide information for you. Make sure that after obtaining the assessment that you secure appropriate identification, the time and date on the specimen, where the specimen was obtained from, if necessary, and complete any requisitions as required by the lab. Make sure the specimens are placed in an appropriate bag or container. Do not contaminate the specimen during collection process. There are several different cultural issues that may affect specimen collection. For example, some Southeast Asians consider blood as irreplaceable, and they can become very anxious about a needle that penetrates the skin and allows blood to seep out. The insertion of a foreign object into the mouth to collect specimens may also be threatening to Southeast Asians because some of those cultures believe that diseases can be introduced through the mouth and that the head is the seat of one's life force. And another instance is collecting stool specimens by Muslims and Hindus because one hand is used for clean tasks and one hand is used for dirty tasks. So it might provide some issues. Again, make sure that you provide privacy and appropriate gender support if necessary for assistance, and hygiene following collection. If you do not take the specimen to the lab within 30 minutes of collection, it may require refrigeration. To collect urine specimens, especially midstream collections, again, obtain the appropriate equipment. You instruct the client to begin urination. Let me back up a little bit. You obtain the appropriate equipment. Within the package that contains the specimen cup, there's usually a little packet of antiseptic wipes. You instruct the patient to cleanse appropriately. Women always cleanse front to back only. They never go back to front. And they cleanse with one towelette one time, and then the towelette is placed in the trash, not in the toilet. Make sure that for women, they go down the middle and down each side. For men, they're going to start at the meatus and they're going to cleanse around the head of the penis all the way down to the glands. So then they are instructed to urinate. During the middle of urination, they stop voiding and place the cup and then begin voiding again, because that initial stream of urine is actually going to flush any potential bacteria out of the meatus. Women should hold the labia apart when they are voiding to obtain a specimen collection. Instruct the client not to touch the inside of the specimen container for a clean catch. They'll cleanse the perineum as I've instructed, and again instruct them to collect the urine midstream. So in other words, they start the flow, stop it, and then collect the specimen. For a catheter, it's necessary to clamp the tubing of a retention catheter for approximately half an hour. Make sure that you have the appropriate equipment. You're going to cleanse the sampling port. If you use a needle, insert it at 45 degrees. But a lot of your sampling ports now have a lure lock attachment that you can obtain the sample from. Withdraw at least 10 cc's of urine. Place the urine into a sterile container, and then you will label it appropriately and send it to the lab. From a straight catheter, then you'll just drain the urine directly from the collection bag into the sterile container. For a 24-hour urine collection, you will instruct the client to begin collecting every void, and you will begin the urine collection at their first void following the order. If even one urine specimen is discarded, you must start all over again. Make sure that the urine is kept cold. They should not place toilet tissue in the urine. If specimen containers, or if multiple containers are required, you'll send the full containers to the lab as they're filled. And instruct the client to void during the last 15 minutes of the timed period. Collecting urine specimens on pediatrics can be tricky. For non-toilet trained pediatrics, usually a U-bag can be placed. It has adhesive and it's placed on the perineum to collect the urine. If it's a little boy, then you can place the penis and the scrotum inside the bag. It's not necessary to cleanse the perineum of non-toilet trained pediatric clients, but soap and water is appropriate for those toilet trained pediatrics. If you have little girls sit on the toilet backwards, it naturally opens up the labia and helps prevent contamination when they're obtaining a urine specimen. For stool specimens, make sure that you put a specimen collection hat in the toilet. Instruct the client to notify the staff following evacuation. Urine will contaminate the stool specimen, so try and prevent urine from getting into the stool. For hemocult specimens, not every facility will allow all units to obtain hemocult specimens or to test them, but if your unit does allow you to do this, you open up the hemocult slide and you'll place the stool specimen from 2 different areas of the stool on the slide. They usually have little sticks that you can obtain the specimen with. Close the slide and then you'll open up the opposite side and drop the developing solution where indicated. For wound, nose, and throat swab specimen, you'll identify the areas that you need to get the specimen from. If it is from nose and throat, you should obtain it 1 hour after eating or prior to eating. Sampling can cause them to sneeze or cough or gag. Instruct the client to tilt their head backward, and without touching anything but the area that you want to swab, you'll swab that area or the purulence. Place the swab in a tube, and if it has an ampule at the bottom of the tube, make sure you crush it. For sputum specimens, the specimen can be obtained by suction if necessary. Sputum specimen may be assisted by providing chest percussion or a nebulizer treatment. It gets them to coughing or helps loosen secretions. Clients should not use mouthwash or toothpaste prior to collection because it can actually contaminate the specimen or cause it to read in error. Make sure they have a specimen container at the bedside and instruct them not to touch the inside of the container or the lid. Usually about half a teaspoon of a specimen is required. A lot of people, when they're coughing, they'll just spit and all you have is saliva. You need to make sure that you have good gooey junk in the cup.